You are listening to the global network of podcasters dedicated to the pharmacy profession. Welcome to the Pharmacy Podcast Network.
We are committed to the pharmacy owner's success. PrimeRx believes in empowering pharmacies with innovative solutions to thrive in today's competitive landscape. We look forward to working with pharmacy owners and sharing how our solutions can contribute to their sustained profitability and growth. Connect with us on the web by going to PrimeRx.io. That's PrimeRx.io.
Hey, welcome back to the Pharmacy Podcast Tech Trends. This is sponsored by PrimeRx. It's wonderful to have Ketan Mehta back on the pods for 2026, kicking this off. I cannot believe, Ketan, it's already February. Are you kidding me? And here we are, and it's time to go. We're already running down the track of independent community pharmacy and pharmacy in general and what AI is doing, but it's so good to see you, Ketan. How are you?
Yeah, likewise. It's always fun to be over here. I think it brings a natural style of thinking about like what are the things happening. And you're right. I mean, the timing couldn't be better. It's 2026, and I'm already preparing for what should be the roadmap for Q2. And I was like, wait, why are we preparing for Q2? And I'm like, oh my God, like March is already here. So it is, time is moving fast. So is technology. So are rules. So are changes.
I'm excited about who's joining us today because Dr. Lisa Schwartz has had her finger on the pulse of policy and technology and strategy in the realm of independent community pharmacy and the evolution of where that's going and payment models. And just welcome to the show, Lisa. It's so good to see you again. It's so good to have you.
Thank you so much. I'm glad to be here.
All right, Lisa, you are the Senior Director over at the National Community Pharmacists Association, the NCPA. I'm going to start with you. It's a brand new year. It's a good time to think about what direction we're going in. What's the blueprint for success in independent community pharmacy? Share with us a little bit about your vision for 2026 and in our independents out there.
Well, we're pretty excited. We've had some bills that have been before Congress, iterations the last several sessions, and just the update that I got from the Advocacy Center this morning, helping prepare for this podcast, we're excited that it looks like some Medicare reform is finally going to move forward. It's never been controversial, but it just hasn't found the right package to advance. So we're seeing there's it was not a like smooth progression because one of the funding bills actually got pulled out before the Senate voted on it. They're going to handle that in a different process, I guess. But the remaining funding bills and the this Medicare Part D reform is part of that. We'll go back to the House. They have to redo their vote because one of the funding bills was pulled out of the package, and we're expecting that to be pretty straightforward and to pass and to finally be able to move and have Medicare, to have CMS define what reasonable and relevant reimbursement looks like for Part D, to have oversight and a little bit more transparency, to have a definition of what a essential retail pharmacy is, in shoring up what access looks like for underserved communities that don't have good pharmacy access across the country. Those are all things that we're looking forward to, seeing we've been putting a lot of effort behind getting good sponsorship support, and hopefully finally passage. So that's kind of the bright shining star in the first quarter of our year this year. We have our Congressional Pharmacy Fly-In coming up in April. So I think there'll be a lot of hopefully there'll be a lot of happy folks there, but with the ability to look at sort of what's next, and maybe to have some like thank you conversations when they make appointments, and fewer of the like pass it already conversations.
I love hearing that, Lisa. Love hearing that.
Like I know you said that you were excited about Lisa. Like I want to share in that as well. I think there is not a single tech vendor in the industry who does not know Lisa or who Lisa has not communicated with, right? One of the reasons why it is really, she brings in a lot of these different kind of things that the pharmacists are going through. It does not have to be necessarily technical, but she's keeping all the tech vendors and the general industry aware about this. So, Lisa, I mean, I just wanted to, on behalf of all the tech vendors, for sure, I just wanted to thank you. I'm like, you bring a wealth of information that we all rely on.
Well, it's such it is integral part of community pharmacy practice. And as I say integral, I'm also picturing the little proteins in the cell membrane. Like there's, you can't, a pharmacy can't exist. Like our cell membrane would explode if we didn't have, a solid backbone. We didn't have that like protein structure of the dispensing system vendors helping us keep our records straight, sending real-time claims, doing the e-prescribing transactions, and then sort of all of the other bells and whistles that y'all are able to support in our member stores.
Absolutely. I mean, like I remember, the M3P and the MFP and all those kind of things that actually have, I mean, strangely enough, it looks like we were talking about it all the time, and now they are actually into practice. And the thing is that NCPA has done such a good job of communicating between the NCPDP, the tech vendors, and the pharmacists, because most of the pharmacists are busy running their businesses, right? Like dealing with all these challenges. And sometimes what happens is we come to know about these regulations from the pharmacist in the nick of time when they are going to be implemented. And we are like, wait, what is that? But with you filling in those gaps, it has really become advantageous. And we have been able to deploy the changes much more effectively with reporting, and then also use you as a sounding board to say, hey, how do pharmacies look at this versus that? And like it really has been a good union. So
the collaboration is very much appreciated. I have my experience behind the counter is now like 17 years distant. But I do hang out with, like one of my roles at NCPA is the staff liaison for the NCPA Technology Committee. And so that's a group of members that are very interested in leveraging technology to make both their business efficient, but also their pharmacy practice efficient and high quality. And so having them as a sounding board as well, it just is, it's honestly, it's fun to be the person that gets to interact with the technology vendors, but then also the technology enthusiast pharmacists.
I think it's really cool, Lisa, that you said this is an opportunity for thanks, where we always, when we're going to Washington, D.C., I was down with a whole bunch of pharmacists during the Pharmacists Fight Back Act that was proposed, and NCPA was there too, of course. And for you to say, hey, we're going to do a fly-in, it's time to continue the fight April 15th through 16th in Washington, D.C. And this is a chance, obviously, to get your voice heard, but it's also a chance to say thank you to those legislators who have really jumped in, Jake Auchincloss and so many of our state representatives and state senators and federal level, that they finally understand. I feel like this is the first time since I entered pharmacy that they really get it, and they're digging into the data, and they're leveraging the knowledge, and they're comparing it back to their Medicaid budgets, and they're comparing it back to the impact of federal level Medicare Part D, and they're seeing what's making sense, what isn't making sense, how the status quo is breaking our healthcare system from the inside out. And now with all of this clarity, I feel like we are truly on the edge of building a new pharmacy care model and how it will be paid for and how pharmacists are going to be leveraged to pull more data into clinical assessment and clinical drive of the entire treatment. And I see the pharmacists becoming much more involved in the chronic management than ever before, and how tech kind of sets up for that. And I'm so glad you shouted out NCPDP as well, because setting up how to collect the data, how to exchange the data, how to leverage the data from all the EHRs, and then getting pharmacists in front of it. This is seriously an exciting time. I know when you get punched in the face as many times as the pharmacists in our independent community pharmacies do, to the point that some of them went out of business, unfortunately, just over the years. This is the time where we're building a brand new ship, and it's different, and I can feel the momentum growing. So I was so excited to see the fly-in. I think it's to be a celebration fly-in in April, but I was also excited to see the NCPDP data come out and really getting the attention of Wall Street, where we're saying, hey, independents make up $103 billion of revenue in 2024. Talk to our listeners a little bit about all of those components. I know I threw a lot of ingredients at you all at once.
One of my my department home at the association is policy and pharmacy affairs, and so I do a little bit of the straddle between pharmacy practice and then what we're seeing in legislation that's likely to be passed, or the rulemaking that's going to happen once we have a law passed. But one of my interesting projects that gets used by just about everybody in the building is the NCPA Digest, which is sponsored by Cardinal Health every year. It's a huge amount of work to collect the data that we use in the digest. It's a long survey that I'm very grateful for the number of pharmacies that fill that out and send that in. We do our survey collection in like May and June every year. So hugely important, hugely helpful for us. That's where we're able to say we know that the average pharmacy has about $5.4 million in revenue. We know that there are 18,900 and some independent pharmacies out there. So, A times B, we understand that there's a huge economic impact that is a result of independent pharmacies existing. We see, go one more. Do we get the two more? New this year, we added a section about our pharmacy access initiative, a collaboration between University of Southern California and NCPA. We wanted to help folks have a good visual for what parts of the country have good access to a brick and mortar pharmacy. There are certainly times where having medications delivered by mail help folks get by, but being able to go and get a prescription filled, as soon as you need it, and address any issues with, is this the right medication, interactions, allergies, some of those mistakes still sneak through on e-prescriptions. But, there are parts of the country, and I'm even thinking of where I have family in northern Minnesota. Our local post office doesn't do the sorting anymore. The sorting happens it's either St. Cloud or Fargo, which is like a good 2 hours away from where my folks live. So for them, having independent pharmacy in town is very important. I'm glad that owner is there. I know he takes good care of my parents. But the circle back, the NCPA Digest, I think, is an incredibly useful report that we put together every year and really helps us understand what all is going on in our members' stores. In preparing for this podcast, we talked a little bit about one of the interesting trends that we're seeing. We have long seen that independent pharmacies dispense medications to patients who live in skilled nursing facilities or assisted living facilities, long-term care. But we're also really starting to see that patients are getting these pharmacy services, long-term care pharmacy services at their home. So we've added a whole program into our long-term care division to help folks understand what's required to offer long-term care pharmacy services to patients who are at their home. It's not just putting them in packaging and delivering them. There are other services that wrap around to qualify and be long-term care services. So we know we've got mark my page here, 55% of our members said that they do some sort of long-term care services, but we also know that there's a range. We've got skilled nursing facilities, assisted living facilities, might be correctional facilities, and we've also seen the number of beds that people are taking care of patients in their home grow by quite a bit. So I think that's a really good opportunity, something that moving forward, a lot of pharmacies are going to see long-term care services as a very important part of their business model and source of revenue, to be honest.
Yeah. And Todd, you did point a lot, there was something about mention about clinical services, and I think Lisa referred to it as well. There's long-term care pharmacies in our network also. They have started utilizing this, and the ability to provide clinical services is something that the pharmacist is coached for. However, in the day-to-day process of managing and running the business, sometimes they miss out on that opportunity because the mindset coached for all these decades is still into a fill and bill mode. So pharmacies that actually utilize, appropriate bifurcation or diversification within their businesses, they tend to thrive more because of profits. The way that they get reimbursed on a LTC claim versus a regular claim, and then the way they get reimbursed for a long-term care at home services or a clinical service versus a regular blood pressure medication that they are transmitting is completely different. And this is where I think that the tech vendors can actually really help them. So is there really, in today's day and age, with automation, AI, data science is all behind this, is there really a need for them to be processing electronic prescription? So what are the things that we can do to map out a prescription that is coming in electronically with the right data that's in your pharmacy, with the inventory, and then essentially reduce the time for them to process a prescription, and the time that is saved can be used into those clinical services, right? So we have actually launched complete automated processes, and pharmacies that are actually utilizing them are saving, there's various levels of tolerance that a pharmacy may want. So from complete automation to partial automation, but on an average, they'll save at least 35 to 40% of electronic prescriptions that they would normally fill by using automation. And we've seen that data just in the initial stages, and I think we are trying to gather more and more of what is it that we can do to automate. So the intent is save time, make prescription filling a utility, and utilize the time to train your staff to provide those clinical services and generate the care plans and generate the medical billing, right? Because that's where I think the growth is moving towards. And I think that the digest that Cardinal has graciously been sponsoring for all these years shows that trend where the pharmacies that move into that kind of services, they are the ones that are thriving more. So there's literally a shift in the industry that everybody has to understand and adjust onto where they should be focusing their efforts in.
And sometimes the inertia is I know, if hypothetical pharmacy owner, I know that my dispensing system has the technology for me to do this better. I've been working with customers before me, people that are at the, my technology committee that are demanding, I need this support, make it happen. And eventually rolls down to the average pharmacy owner who's yeah, I really need to figure this out now. Some of the inertia comes over, how do I actually change my workflow, what staffing, how to identify somebody who's on staff who's going to be good at this particular role or this particular role, cross-training them. And a few years back, the Community Pharmacy Foundation gave a grant for Flip the Pharmacy. And through several cohorts of training groups of pharmacists, we helped them identify digestible bites of their workflow to tackle. Those materials are still online. You don't need to be part of a Flip the Pharmacy cohort to go out and look at the materials and decide to work with your staff on doing some practice transformation to make sure that if you have the technology that supports freeing up this time, that you do it in a way that's smart so that the time isn't minutes here and there. It's a half hour here and there where you can actually do some focused work or start making some patient appointments.
I think we can do, as tech vendors, we can actually do a better job at that, right? That means what I'm trying to say is, yeah, we have had all these features and functions for so many years, right? But we were still focused on filling the need for fill and bill. The reason is because that's what majority of the pharmacists were doing, right? So yeah, you want to generate a medical billing file? Okay, you can click here, do this. Or you want to generate a care plan or a clinical documentation? You can click here, do this. So while all these options are available, we could actually do a better job of bringing them into the workflow along with the automation. So that way, they don't have to remember to go and do something. It should be a part of their natural filling process workflow. So the fill and bill should include the ability to identify new therapy, the ability to generate automated care plans, the ability to generate automated billing, medical billing files. We should be able to integrate with vendors that specialize in those kind of scenarios that are actually helping the pharmacies, and then just keep on moving in that direction, right? And I think there is room for improvement, and there's a lot of opportunity over there where we as tech vendors can provide that or bridge that gap rather.
I'm excited, Lisa, when I'm hearing from pharmacy owners and they're rolling out new programs that I've never heard pharmacists managing before. It all started with immunization programs and extension of long-term care at home services. I heard more about remote patient monitoring systems and services that they're getting reimbursed for. And now I'm hearing about testing. I'm hearing about allergy management, contraception. I'm hearing about all these other services where we've always said that the community pharmacy was that healthcare hub of their community, but it literally is. I mean, everything that's cultivating, everything's being tied in. It's not really about the prescription anymore standing alone. It's like that's a component of a bigger picture of what our community pharmacies are going to be able to dial into. And then you have the super duper stars that are then saying, hey, I want a physician assistant to be assigned to a clinic style environment where I'm actually offering general healthcare services that are a business that's attached to my pharmacy. And then long-term care at home is opening deeper doors for bringing in light bathing and shopping and like having those home care services that are now being embedded. So this realm and this part of healthcare, which is the long-term effect and education that's coming from our independent community pharmacy, it's going to be a whole different looking business, 5-10 years from now.
Isn't that the truth? I'm thinking of things, the different services that you had listed off, and having a co-located health clinic. That's something that we've talked about for years. Members here and there, ones and twos, figure it out. But finding that scalable model has been something that is still super interesting, especially for some of the pharmacy shortage areas where it's a pharmacy shortage area. And if a pharmacy were to open up great. That addresses access to prescription medications, but there might also, it's a really good chance actually, that it's also a primary care shortage area. So even some of the things that are in scope for pharmacists to do can address some of those primary care gaps. But the opportunity to have, sort of a mid-level practitioner there as well, super, super exciting.
It really is. Ketan, we've set the stage over the years of building a system that is now like a Lego machine that you just snap on the next thing in the, on the Legos so that you can actually execute. Talk to us a little bit about the realm of artificial intelligence and where AI ties into the success of our independent community pharmacies.
Yes, so we have actually started working on there are three facets to AI. From where we stand, we see that AI can actually help the pharmacy if you actually break it up into those three-dimensional facets. So the first one is the consumer-facing side. So, the consumer of today needs everything on their phone and text messages, etc. I mean, like most of the times they like to talk, and if so, then on a secure line, people want just convenience, right? So we are trying to bring in that kind of a model to the patients where they go through an appless environment where everything is initiated through text. And then essentially what the pharmacist does is when they call, pharmacist is looking at the screen and then interpreting the data that is being relayed to them from a pharmacy management system and then talking about that to a patient, right? So some of the stuff we can automate because we have we can actually authenticate the patient in a secure manner. Once the patient is authenticated, we can talk to them about their medications. Is it ready or not? If they have a copay and they'd like to pay for it, or the store hours, all this information is what typically the pharmacist is on the phone line for, right? So we are trying to bring AI into that kind of mechanism for the phones, and also we are allowing them to chat with an AI bot that can securely send that message that like, hey, these are your refills. Do you want to authorize, pay for it, and all that kind of stuff. So with the phone and the chat, that's what we are doing. The second one is the product side, where we are putting in AI into the system. So for example, a lot of the electronic prescriptions come through. We see that the day supply is missing, right? And most of the time, the system usually prompts it like, hey, day supply missing, please enter. But you could actually use AI by looking at the directions, knowing the medication, and like automatically populating that kind of data, right? So those are the kind of stuff that we can actually bridge into the pull into the product, so that way the AI can be utilized for the pharmacy. And the third facet is the service side. So pharmacies call us for support and service most of the times. It's the same scenario that is happening in one pharmacy, and the same solution that is happening in one pharmacy is being applied to thousands of them, right? So you are getting the same phone call and you are just answering the same thing. So we are using the knowledge-based articles that we have to generate a AI bot that can respond to the standard questions that our typical pharmacists have. Beyond these, if a patient wants to speak with the pharmacist, we are not stopping that. We are still allowing the patient to communicate effectively. We are just trying to utilize the time for the pharmacist smartly. If they are interpreting the same data through their mouth, we are simply using AI over there. And the same thing that we are doing for our support teams.
That's exciting. Being able to, some pharmacies talk about having, switching on an IVR or switching IVR providers, something along those lines, and just noticing how much quieter and calmer the pharmacy feels without a phone constantly ringing. I think that makes a big difference. If a lot of the calls can be just handled with an AI agent, refills get processed, prescribers get to leave messages, whatever it looks like, easy questions. Are you open today? What are your hours? They get handled without having to talk to a live person.
I want my prescription delivered versus picked up. I mean, like, do you really need people to be on that call for those 3 minutes? And you know what? I think as this technology matures and more pharmacies adopt, I actually think it will aid in less errors as well. Because what happens is when you are filling a prescription and then you're distracted by phones, that's what actually breaks your thought pattern into a clinical decision, right? So if we allow less and less noise into the pharmacy and let the pharmacies be more calmer, I think they will make less errors as well. So it will actually help them.
I think the pharmacists feel like they're having a better interaction with the patients that are in the store too. When there's less distraction behind the pharmacy counter. Most of the time, it's really nice to have a conversation with the patient, even if it's not, once we've taken care of any questions that they have about medications or first aid, or if I'm doing some sort of little triage question that they have about symptoms that have shown up. But to also, ask about family or other events that are going on in town. That was, I grew up in a small business. My parents owned a small business and then worked for my next door neighbor when I was in high school in his pharmacy. And, it was nice to be able to have those sorts of conversations when patients came in. There was one gentleman who had come in and he had a different magic trick every time he came in. So I always got a little magic trick from Bill.
That is cool. That's the specialness of the relationships that are built with people in the community, and then the networking that happens within the community to understand. I had no idea my independent community pharmacy did this, or this. And it's that continuing banging of that steady drum for being the advocate of their patient and fighting for their patient. And you just don't get that with some of the, I'm a fan of the big chain pharmacists out there because I want them to succeed too. But there's just a flavor difference of it all. It's almost like, you can eat Chick-fil-A, which is my most favorite, fast food ever. It'll always, nothing beats it for me at least, but I'm not eating that every day. I'm going to go home and get some nutritional food. And I just feel like it's the difference in pharmacy of what our independents are able to do, because it's customization. Everybody keeps saying those buzzwords, precision medicine. Well, what does that mean? That means personalization. That means, hey, you are patient. You might have a number in my system, but you're completely different needs than anyone else that's coming into my opportunity to engage you and talk to you about better health. And then that trickles down into the entire families that these people are taking care of. If one family member has diabetes and the rest of the family is accessible, there's lots of questions that can be asked. Hey, how's everything going with your children? Or how's your grandmother doing? And that inclusiveness is what healthcare is missing when it's being pushed into fast bang, 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 bang. Let's do 1,000 prescriptions a day and barely make it. Now we're being drawn back. I don't want to say the old fashioned days, but drawn back to a time where things were just a little bit more slowed down, but it was the quality of the healthcare being provided versus the quantity.
You mentioned precision medicine, so that makes me think of one of the interoperability challenges that we have right now. I was working earlier today on a project. NCPA has a elective rotation. So right now we have pharmacy students that are on rotation with NCPA. We do it virtual and then also in person in DC. But one of them is very interested in technology and how pharmacies, how practice management can be assisted by technology. And I said, well, let's look at this list of 60 some, and so there's 62 approved message codes that exist in the NCPDP standard to tell the pharmacist in a codified specific way. So it's not free text. It's like a 2-character code, numbers 1 through 62 presently. Something about the approved claim response that's come back. So most recently, with the maximum fair price, the drug negotiation program, we all got real attuned to the approved message code 061, right? That this claim is eligible for the maximum fair pricing. There's a different approved message code that would tell the pharmacy that refills for a particular medication are going to be dependent on the patient having a match with their pharmacogenomic panel. So how does the pharmacy know what the patient's pharmacogenomics are if they've ever had testing period, or maybe testing needs to be ordered? So I think that gets at my point of something that's an interoperability gap that we're experiencing right now. I don't know that pharmacogenomic results are well standardized. I think there exists some standardization for, the metabolizer status on the various CYP enzymes or other enzymes that we're curious about for pharmacogenomics. But that's really important information and could be really useful to have available. Like, if the testing has been done, how can it be incorporated into the patient's prescription profile, sort of along the lines of an allergy status or some other intolerance, so that anytime a new prescription comes in, the pharmacy can screen for that right away. We know some health plans can do that, but that's probably in a case where they required and then paid for the particular test. And it could be specific gene, it might be a panel. We don't know.
I think, and all those, as the standards evolve, so does technology, right? That HL7 used to be the mainstay, and now everything's fire because the expanded data sets and all that. So sometimes I wish like you would go into something and break it and restructure it with the modern or the current reimbursement and the modern pharmacy inside, right? And then also centralize that data feed so that way all these clinical decisions can be made appropriately by the pharmacy, by the prescriber, or any of the caregivers, right? And patients being central. And there are a lot of organizations that have started doing this. I think adoption is primarily an issue. The reason is because the reimbursement cycles have not necessarily fallen through that, right? So what happens is you may have the best intention, but the technology, the ability for you to coach your staff in a particular manner and then provide that patient the care that they are supposed to get, right, is where I think the opportunities are. Like the pharmacogenomics code that you're referring to, you could have a code, but as you said, in absence of data, then like, what do you do with that, right? Like you have the ability to communicate, but then you still have half of the other standards that are not merged in. So, there will be a point in time when, the policy people, legislators, the tech vendors, everybody will come and agree on a communicating standard and all the things that need to happen in place for the modern pharmacy. And I think I'm looking forward to that day when that happens. But I think if that were to happen, that would be a perfect kind of match in heaven.
Lisa, you have an opportunity to connect with so many different pharmacies at different stages of their evolution and being more profitable and setting up maybe to buy other pharmacies or expanding their long-term care pharmacy at home. Is there anything that's very bright to you right now? Very, you're like, wow, this is a space that more and more of our independent community pharmacies, they have to adopt this service or this one thing just to give them direction as to what they should be spending more time on of what the next evolution of their business looks like.
Yeah, the first thing that comes to mind is long-term care at home. I think a lot of just sort of the way that long-term care facilities are operated, staffed, funded. There's some, and we're probably not fully on the other side of whatever the disruption event that the pandemic was for those sorts of entities, but the workforce, the long-term healthcare workforce suffered a bit, but I think long-term care in particular. So I think we are seeing a lot of folks that are much more interested in aging at home and how, between any private long-term care insurance or Medicare or even self-pay, how that how that comes together financially. But then also there still needs to be a workforce for somebody to have long-term care at home. So I think that pharmacy potentially has the ability to really support high quality long-term care at home services, being able to provide consistent high quality medication services, sort of the never out situation, the quick response when meds change is super important. I guess that's what comes to mind first. I think another thing that even has crossed the administrations and remains a high interest from HHS is identifying and trying to help folks have avoid a diabetes diagnosis, but once a diabetes diagnosis exists, manage blood sugar and avoid consequences of poorly controlled diabetes. So I think that's another, we have been helping pharmacies stand up programs at their pharmacy that meet the National Diabetes Prevention Program criteria. That's a formal program that CMS recognizes and would open up to pharmacies additional revenue sources for having a recognized program and offering those services. So I think diabetes prevention, diabetes self-management is one that is going to stand the test of time. That will always be an opportunity for pharmacies, I think.
Agreed. I just want to shout out and say, thank you, Lisa, for being a part of this change and this sustainable change, this change of growth, where it's not just a change in the same model that you and I entered when we entered pharmacy originally. It's really new. If you're graduating pharmacy school in 2025, 2026, 2027, your pharmacist career is, drastically different than what a pharmacist that graduated 20, 30 years ago. And the evolution of how the government, how payment systems, how private insurance, how HHS looks at community pharmacy will never be the same, since the pandemic shows that 93% of all of your immunizations, of your flu shots, 93 freaking percent, my goodness, is coming through our community pharmacies. That is if you're keeping the nation safe, if you're keeping the nation healthy, it's coming from your community pharmacy. And that of all of the stats, that's one I was most proud of to see in the latest digest.
Yeah, one thing that'll be really exciting, you talk about folks that are graduating now and what practice can look like for them in the coming years. There are task groups at NCPDP that are looking at what does a standardized medication profile look like. There's a FHIR resource for that, but what does adoption, what does a healthcare environment look like when pharmacies, patients' primary care, the patient themselves, and any specialists all have access to the same medication profile for the patient? What's active? What allergies do they have? What have they taken in the past? What was the reason something was discontinued? Super exciting. I mentioned the diabetes prevention program. There's also exists a transaction for between any healthcare providers to make a referral. There's no reason that a primary care can't make a referral to a pharmacy that has a diabetes prevention program. Say, patient, I need you to go and get enrolled in this patient's pharmacy. Pharmacy can accept the referral. They can report back. They could use a care plan to do that potentially. There's also a standard for a pharmacy consultation note that's used in long-term care much more than in community regular pharmacy. But those all exist and could be really exciting ways of making sure everybody has the same information about the patient that we're all caring for.
Absolutely. Ketan, what do you want to shout out to the listeners right now with regards to plans for 2026, things that you've seen become successful programs for our independent community pharmacies in 2025 What have you seen standing out and shining in the clients that you serve and help?
So, I think the pharmacists know this business better than anyone else. The main challenge for them has been just time and the effort to have this mind shift, right? All the opportunities are there. They, like us, a lot of other organizations have been speaking about the care plans and the medical billing and the nursing home LTC at home options. So they are aware, but they are just plagued with the amount of work that they are doing. And I think if they start investing more into the automation and the AI pieces of it to free up their time, right? So that way they can then take advantage of those kind of opportunities, that would be helpful. Like I think like M3P and MFP, there's tons of changes that are coming down the road. I know the standards are changing in 2028 January for e-prescribing and subsequently for the D0 transmissions as well, the telecom communication standards. So that's changing, and those things are going to actually impact. Those things are going to impact the pharmacists a lot more down the road, right? So we as tech vendors are trying to do everything that we need to do to bring these changes in the most seamless manner as possible. And as long as they are invested into making sure that these work, it will help them, I think.
Well, I tell you what, it is exciting time. It's time to plug in. It's time to learn from other organizations as well as our independent community pharmacy owners and operators that are doing things differently. And they flipped their pharmacies years ago, and now they're ready to bring on the new services that are going to be provided by independents. But a shout out to you, also to our technicians. The role of the technician is going to change, just like the role of our pharmacists are going to change and become enhanced with a dig down into treatment and a dig down into holding the hand of the patient a little closer, and also backfilling so many of the sections of our nation that now have healthcare deserts, healthcare service deserts, and pharmacy deserts. There's an opportunity for our well-positioned independent community pharmacies to backfill and to grow. So, we've been through a lot over the last 3 years with DIR fees and things that are happening in our markets, but I think we're through the worst of it all, and I think what's coming now is going to be a rebuilding of what is our independent community pharmacy's purpose, and how have we communicated that purpose out to the communities, out to our people, and to our nations and our news organizations to finally tell the public what pharmacists are capable of doing. This is awesome. But thank you, Ketan, for being part of this. And Lisa, this is so good to see you. I hope we have you back sooner than later, for sure.
Sounds like a plan.
It was fun to be here, Don.
Thank you so much for listening to Pharmacy Podcast Tech Trends, sponsored by PrimeRx. For more information on PrimeRx, please take a look at primerx.io. And there's a podcast tab there too to listen to other shows. Reach out to your NCPA contact. If you are not a member, please look at the new services being offered through the NCPA, starting with the powerful data coming from the NCPA Digest, and get ready for the Super Bowl of independent community pharmacy get-togethers and conferences in October in Kansas City. I think it's in Kansas City this year. Is that right?
That's correct.
Yeah, I can't wait. All right. Thank you both for being here.